What medications should you avoid when using ginger for gout? If you're thinking about using ginger to help manage gout pain, it's important to know that it can interact with some medications. Ginger is generally safe for many people, but it can affect how certain drugs work or increase side effects. Always talk to your healthcare provider before adding ginger to your routine, especially if you're on medication. One major group to be cautious about is blood thinners. Drugs like warfarin, clopidogrel, and aspirin are used to prevent blood clots. Ginger can enhance their blood-thinning effects, which raises the risk of bleeding or bruising. If you're on these medications, your doctor might suggest monitoring your blood clotting levels more closely or adjusting your dose. People with diabetes often take medications like insulin or metformin to control blood sugar. Ginger can lower blood sugar levels naturally, so combining it with diabetes medicines might cause hypoglycemia, which is dangerously low blood sugar. If you have diabetes and want to use ginger, regular blood sugar checks are essential, and your doctor may need to adjust your medication. For those with high blood pressure, medications such as beta blockers, ACE inhibitors, or calcium channel blockers are common. Ginger can also lower blood pressure, so taking it alongside these drugs might cause your blood pressure to drop too much. This can lead to dizziness, weakness, or fainting, so careful monitoring is advised. Ginger may also stimulate the immune system, which could interfere with immunosuppressant drugs like cyclosporine. These medications are used after organ transplants or to treat autoimmune conditions. If ginger boosts immune activity, it might reduce the effectiveness of these drugs, so always discuss this with your doctor. Medications that affect stomach acid, such as antacids, H2 blockers like ranitidine, or proton pump inhibitors like omeprazole, could also be impacted by ginger. Ginger influences stomach acid production, which might interfere with how these medicines work or are absorbed. Lastly, ginger can alter how the liver processes certain drugs, including some antibiotics like metronidazole. Since the liver metabolizes many medications, ginger might change their levels in your body, possibly increasing side effects or reducing effectiveness. When it comes to gout medications like allopurinol or colchicine, there's limited evidence about direct interactions with ginger. Still, because herbal supplements are not always tested for safety with prescription drugs, it's best to inform your healthcare provider about any herbal remedies you're using. In summary, if you are managing gout and considering ginger for pain or inflammation, avoid combining it with blood thinners, diabetes medications, blood pressure drugs, immunosuppressants, or stomach acid medicines without medical advice. Always consult your healthcare provider before adding ginger to your treatment plan to ensure safety and avoid unwanted interactions. Remember, personalized medical guidance is key to managing gout effectively and safely.